like to present my work. On the program, the Lyme disease is misspelled L-I-M-E, and in this talk, I want to tell you that Lyme disease is one of the few major causes of atrial fibrillation, and which direct oh. Okay, first, I would like to explain standard technique of the finding out any condition of the abnormality in the SA node or AV node or His bundles. You have to put a catheter to the inside of the heart, and you measure and using special amplifiers. And also you have to eliminate frequency less than 50 hertz, and higher frequency you eliminate in order to get a reasonable potential. But what I'm presenting is that without using this non-invasive technique, in other words, normally you have an electrocardiogram, and in order to get all this detail, you have to put, and like this, you have to get electrode inside of the heart. It's an invasive technique. You cannot make a diagnosis in a matter of the 5 or 10 minutes. And for example, these are the His bundle electrocardiogram, and you get all this potential. But in order to get all this, you have to put a cardiac catheter, and you have to have an electrode on the tip. And to localize the exact location, you have to check the position of the X-ray position of the tip of the heart. Thank you. So, like example like this, you put a cardiac catheter, and depending on the location, you make a measurement. These are just copies from the some of the latest textbook on the electrophysiological study of the heart from Japan. And then when we examine the atrial fibrillation, all this recording was taken from the published articles. We found, I wrote BB. BB indicate Borrelia burgdorferi. It's a Lyme disease, causing Lyme disease, and they are spirocheta. And we can measure non-invasively using technique we developed. It's called electromagnetic field resonance phenomena between two identical molecules, for which I received the US patent 1993. Using this technique, it is very sensitive and non-invasive, so we can measure any molecule, or like in case of the Lyme disease, this is, you have a monoclonal antibody. Using monoclonal antibody, we can check each part of the electrocardiogram, and we can determine if there is any infection of Borrelia-Burgdorferi. And we found most of the atrial fibrillation have this Borrelia-Burgdorferi infection. And the maximum amount we found is about 1,000 nanogram BDORT unit. The reason we call BDORT unit is the name of the technique. We abbreviated, and so these are, as you can see, in this case, they have this red area all indicate infected area, and they are all 550 nanogram. And here they have a red, all this red area, they have 800 nanogram, and this is 1,000 nanogram. But we found most of the atrial fibrillation start anywhere between 500 to 1,000 nanogram. And then when we check most of the published atrial fibrillation electrocardiogram, we found at least about 70% has a Borrelia-Burgdorferi infection, but amount is very little. Some of them are only 100 or 50 nanogram, but still they have atrial fibrillation. Then question is it a known fact? So we check the NIH report. They don't even mention as a major cause of the atrial fibrillation, Lyme disease. And also, we check the Mayo Clinic's report. They don't even mention Lyme disease as any major cause. So, and at the same time, some of the atrial fibrillation have no infection of Borrelia-Burgdorferi. So question is, why some of them are less amount they create, and some don't have it. So obviously, the one Borrelia-Burgdorferi infection is zero. They must have some other cause. But the percentage is, about 30%. We cannot find any Borrelia-Burgdorferi infection. But about 70% of all the published atrial fibrillation, we found some degree of the Borrelia-Burgdorferi infection. And this is one of the most commonly used textbooks in Japan. They have atrial fibrillation. Again, this one has a 600 nanogram Borrelia-Burgdorferi infection, and some of them 600 nanogram, and some of them zero. So there's three examples written on this textbook, and two have a Lyme disease infection. One don't have it. And this is, again, same textbook. We find Lyme disease in this. So we check NIH, they don't even mention the name of atrial Lyme disease as a cause of atrial fibrillation. And then we went to Mayo Clinic. They list number of the items. None of them includes Lyme disease. So, question is why? The reason is electrocardiogram does not show visible changes by Lyme disease, specifically detectable for Lyme disease. So we examined some of our few patients meticulously and see these relationships. This gentleman is a physician who often take my course for the past few years. He just recently told me he has some mild pain around here. So we checked. As I mentioned to you, this technique is non-invasive. From distance, even without even touching directly, we can detect these. And when we checked, just very quick test, we found borrelia burgdorferi was 550 nanogram, and here, and so we asked him to get the electrocardiogram. And this part was 200 nanogram, here 550. Now, Lyme disease, usually they have these spiral shape, and this is a typical pattern you see under the microscope. So when I examined, we found this red area. We found this is a magnified, 200% magnified, and this was a electrocardiogram sent by email, so this line somehow lost. So you can see that he has a 600 nanogram, this red area. And the green area, they have no infection. And then we asked him to take some medication. And he took 30 minutes after taking medication. The medication consists of amoxicillin, 500 milligram, with vitamin D3, 400 milligram, 400 international unit, and taurine, 200 milligram. The reason we add all these things is that we found when we give optimal dose of vitamin D3, they have a extremely high amount of the urinary excretion of Lyme borrelia burgdorferi in urine. And but by giving amoxicillin, they will be killed. And
2 minutes.
Oh,
2 minutes.
Oh God. Okay. Anyway, then we checked this area, infected area. Just in that area, cardiac troponin I is 12 nanogram, and atrial natriuretic peptide is 120 nanogram. And you can see 30 minutes later, they reduced to cardiac troponin I 2 nanogram. And then after taking 5 days of treatment, it further reduced. And then we found his wife had complaining something also chest. So we asked, take electrocardiogram, and so she brought electrocardiogram. We saw she had also Lyme disease, but amount is only 70 nanogram, all this red area. And then a week later, we asked to send the electrocardiogram, and she was not taking any medication. Oh, this was a magnified one of the first time she took electrocardiogram without knowing anything about her condition of the heart. Then about 1 week later, we asked to send me the electrocardiogram. And we found it increased 600 nanogram. That is the amount usually develops atrial fibrillation.
Please finish.
Yeah. But you can see electrocardiogram reports say normal electrocardiogram. So here's a normal electrocardiogram according to the present cardiology interpretation. But there is a significant infection in specific area of the heart, but this one did not produce atrial fibrillation. So question is, why this one does not produce atrial fibrillation? So we checked, although when I made this slide, I did not have a recording, but later on we measured. Cardiac troponin I is 2.5 nanogram before, when it was only 70 nanogram, and 600 nanogram still have a cardiac troponin I 2.5 nanogram. So we checked all other these.
Could you please finish? We're way over time.
Yeah, we found when the atrial fibrillation develops when the cardiac troponin I increase more than 15 nanogram usually, and if it doesn't increase, they don't develop the atrial fibrillation. And well, anyway, since we don't have time, I have all the records and proof with another typical example, but I cannot show you because we have no time. But you can see how important it is, and normal electrocardiogram has ready to develop atrial fibrillation. But for some reason, certain patient does not increase cardiac troponin I, they don't develop the atrial fibrillation. Thank you very much.